Hi, everyone. I'm Norma Loeb, founder of the Lewy Body Dementia Resource Center. This video series has been created to bring awareness through firsthand experience of people living with Lewy body dementia, their caregivers, and through expert physicians. This crucial information will be shared with healthcare professionals, with families, and the general public to heighten awareness and to enable correct diagnosis. Please know we are here to help you every single day on our live helpline. I thank you for watching.
Behavioral issues are very common in people with Lewy body. Some of these behavioral issues are because there are changes in the brain that regulate or help us process how we're feeling and process how we react and how we understand the rest of the world. And some of them are kind of secondary. So the person who doesn't remember or understand some of what's going on may have a normal behavioral reaction to something that is abnormal. So as an example, a delusion, some people say, oh, well, my wallet was stolen. Well, if you left your wallet on a table and you went away, you came back a minute later and the wallet was gone, you'd think someone stole it too. So that's not necessarily an abnormal thought. It's a normal thought. It's just based on something that doesn't happen to be correct. So you forgot that you moved your wallet and therefore you think someone stole it. And so people with Lewy body can have a range of behavioral problems that are sort of directly caused or that are indirectly caused by their disease. Some people get very, very irritable. Some people get agitated. Some people get violent, either physically violent or verbally abusive, aggressive. And this can be related to some of the delusions or hallucinations that are also common, or it can be somewhat separate. Some people can have a range of other behaviors that are sort of mistaken for a quote-unquote behavioral problem. So in the middle of the night, if you have what's called REM sleep behavior disorder and you're punching, kicking, moving in the night and you punch your bed partner, well, it's not that you're trying to be violent. It was a violent act, but it was caused by a sleep disruption. So some people have slowed thinking, slowed processing, and they're not as reactive and they think it's more family or caregivers might say this is more of a behavioral change, when really they just need a little bit of time and they weren't able to get out their response in time.
As far as behavioral and personality changes, I think I'm luckier than some caregivers. He was only a couple of times belligerent toward me. Once he tried to leave the apartment and our doorman stopped him in the lobby and brought him back home, and he was having a terrible delusion of fear and kept begging me, please don't hurt me, please don't hurt me. And he kept saying, my name is Paul and I was a school teacher and I've never hurt anybody, please don't hurt me. And it was very heartbreaking to me and difficult to calm him down. And the only other time he ever got angry in that way or belligerent was right one night. He just was defiant that he was going to leave the apartment and I didn't want to let him, I kept saying, it's cold out. I kept trying to distract him and he finally said, if you keep stopping me, I'm going to have to hit you. And I said, well, I don't want you to hit me. He said, I don't want to either. So that's as far as we got to almost being violent.
A lot of anxiety. And I have tremendous disappointment, at the way that this is interfering with my life. I didn't want to change so many things. And I have had to change a lot of things. So I'm resentful of that for sure. And I'm trying to be safe. I didn't realize so many things I did were considered dangerous.
Lewy body sufferers they have a tendency to become, and my neurologist asked me this, and I described it as like sort of there's like a wet blanket placed over your life. I mean, you still understand life, everything's there, but you're a little apathetic. You don't really get involved in things. Things don't excite you like they used to anymore. And I myself, I don't know if this is true of others, get very anxious when I'm going to have people over now. I'm not sure why that is. I think it's because I'm uncertain how I'm going to be feeling or how I'm going to be acting. Am I going to be doing things right? I've learned with my wife, loving wife, to help me that people don't really care about that anymore. I mean, they want to see me, and if I forget what I was talking about, it's no big deal. But I don't jump out of bed excited to do things.
So another significant part of Peter's Lewy body was apathy. He was just so apathetic. You really could not motivate him really to do anything. There was nothing. We tried Alexa Pro to hopefully help that, but that really didn't. That sort of backfired. I don't exactly remember what happened with Alexa Pro, but it just didn't remove the apathy that he was having. So apathy was definitely a big part of Peter's illness, and probably still is.
My husband and I have been married 45 years in October, and we've had a great, and I'm not just saying that, we've really had a blessed, wonderful marriage. We rarely argue. Well, 6 months before the diagnosis, everything was getting to me. I was very irritable, and I would pick on little things, and it got extremely bad. I mean, it was every day, and it was usually late afternoon on, to the point that both of us thought, we can't live like this. Everything was bothering me, so I thought I couldn't live there. And I was driving him crazy because of my behaviors. So since I started the medication for the LBD, that has let up tremendously. It's not an everyday thing, but I do find that after 5 o'clock, well, the neurologist told me not to do anything stressful and basically not to do anything that wasn't fun or pleasant. And so the combination of the medication and his suggestion, occasionally will catch, my husband's very good at catching himself when he sees that I'm reacting irrationally, usually, where normally something wouldn't bother me, and now it's a great big grand deal. He catches himself, he can see it coming, and I normally can catch myself. I can hear it, I can feel it, that I'm going to be not a very nice person to be around.
The treatment of dementia with Lewy body is very multifactorial and really needs a team approach, because although there's no real cure for dementia with Lewy bodies, there's a lot of things that we can do and things that we need to avoid in this condition. So, one of the most common symptoms is hallucinations. And luckily, there are several medications that we can use to treat those hallucinations. And oftentimes I work closely with our psychiatry colleagues to help with this. But there are a few medications that are safe to use in dementia with Lewy bodies for hallucinations. One is called Seroquel or quetiapine, which is what's called an atypical antipsychotic. And this medication is used in a lot of other conditions, but it's one of the safer medications in dementia with Lewy bodies. Another medication, which is a little bit stronger and a little bit more complex to deal with, is called clozapine, or Clozaril is the other name, which was not to be confused with clonazepam, which is a very different medication. But clozapine is also an antipsychotic, and it does work very well in dementia with Lewy bodies. The problem is you need very frequent blood draws to keep track of your white blood cell count to make sure that doesn't drop. But it does work very, very well. There's also a medication that's currently approved for Parkinson's hallucinations, not yet approved for Lewy body hallucinations, but my thought is that it will be shortly, is a medication called Nuplazid, which is very safe in this spectrum of diseases and has a very unique mechanism, and it seems to not worsen any of the physical symptoms of dementia with Lewy body. So those are kind of the three medications that we sometimes use for hallucinations in Lewy body dementia. When we talk about some of the other symptoms, it really kind of comes down to each individual symptom as far as to how we treat it. So sleep is a huge problem in dementia with Lewy body, and there's 4 or 5 medications that we oftentimes can use in this condition, in the sleep component of it. So mirtazapine or Remeron is the brand name for it, is a common medication. Trazodone is another common medication. We oftentimes use Seroquel as well for sleep. Now, all these medications aren't perfect, but at appropriate doses, they're relatively safe in dementia with Lewy body. And one of the things that's important to understand about this condition is there's a lot of sensitivity to medications. So even the best medication may not work for a dementia with Lewy body patient. That's why it's important to have an individualized therapy, because some medications may work, some may cause side effects, and some unfortunately may actually worsen the condition if the doses are too high.
I take rivastigmine, which is the patch, and that's supposed to be for memory. It's really hard to tell if it's helping or not, but I've been on this for like 2 years now. I can't say that things are really, well, my memory is not good at all. And the rivastigmine is really the only medication that I'm taking for the Lewy bodies. But I do take for anxiety, what is that, Zoloft, which I believe, which is more for anxiety. That seems to be making a little bit of a difference, but I'm much more anxious than I've ever been. It's still not normal. Those are really, that I took Aricept when I was first diagnosed, and I went home and I got very sick from the medication. So I stopped taking it, and it turned out that was the medication that I was taking was more for Alzheimer's. And so I really have, other than supplements that I take, I don't take any other prescribed prescriptions.
Initially, what was prescribed medication-wise for Nikki was donepezil. Why? Because it was said that if there was anything good happening in the brain, it could stimulate what was good. And he stayed on that. He had no side effects from it. It was fine. Very late in the game for him, like a month before he actually died, he was having really bad anxiety issues and anger issues. And our general physician felt that Seroquel might be helpful. And for most people, it probably would be. For Nikki, it had just the opposite effect. It actually made him more aggressive, more angry. I mean, it was frightening to see what happened. And we weaned him, I guess I allowed it to go on for a couple of days before I realized this is really bad, called the doctor, and we weaned him off of it. But he never went completely back to being anywhere near tranquil after that. The Seroquel had triggered something else in him, and or maybe the disease, or maybe the combination, but it was just not good. Medications, as we all know, or as we hopefully should know with LBD, is that medications some medications are very, very dangerous, and you have to be extremely careful about what you give somebody with LBD.
There are certain medications that didn't agree with him. The Seroquel actually worked the first month. It was wonderful. And then all of a sudden, it wasn't. It made him, we learned later, it made him want to move and want to run. And it made him angrier at times. But he bolted, he took off. And I later learned that about 15 or 20% of people who take Seroquel with Lewy body will have that side effect.